Now look into the news. Recent reports have been made that there is an indication of increase in the seasonal flu cases, particularly in the region of the Delhi-NCR. So this signifies the importance of the seasonal flu, the vaccinations, especially for the high risk groups like the elderly. So first let us see what is the seasonal flu. It is a communicable disease and it comes under the nodal ministry of the Ministry of Health and Family Welfare, and also it comes under the other organization, that is the National Center for Disease Control, who also come under the Ministry of Health and Family Welfare. The NCDC are mainly known for their being the regulatory body for the communicable diseases. So it brings in the surveillance and it provides guidelines for protocol implementation and other guidelines. Now let us see what is the influenza flu. The influenza flu is a contagious respiratory illness which is caused by the influenza viruses. So here they are transmitted easily from person to person through the droplets. And looking into their symptoms, it includes sudden increase of the fever, which is high fever, having muscles to aching or aching muscles, bringing in headaches, and having severe malaise, that is the increase or sudden increase in the illness of the body, having non-productive cough, that is the dry cough, where it doesn't involve production of the mucus but it brings more irritation to the throat, and having sore throat. And in serious cases it can lead to hospitalization or even lead to casualties or death. Now let us look into the types of influenza virus. So here there are 4 types of influenza virus. First is the influenza A viruses. They are classified into subtypes according to the combinations of the proteins which are present on their surface of the virus. So influenza A virus is always like the subtypes present according to the protein present. So here we can take example like the AH1N1, AH3N2. These are just combinations of the proteins and they lead to formation of these different subtypes. So here AH1N1 can be famous for its swine flu. And influenza B virus, it is not classified into subtypes, but here it can be broken down into lineages. So they involve genetic modifications. For example, they belong to B Yamagata or B Victoria lineage. So they all belong to this type of B, but there are different lineages present or the genetic modifications present. So the difference between A and B is A is will be affecting both the humans as well as the animals, but B it mostly affects the humans. So these are the differences between A and B, and A and B is the most severe one as they come under the prime importance of the public health system and public health policies. The next type, influenza C virus, they are detected less frequently and usually it causes mild infections, and so they do not present public health importance. Next, influenza D virus, they are primarily affect the cattle present and are not known to infect or cause illness in people. So these are the 4 types of influenza virus. So who are the people at risk? First is the pregnant women, next is children under 59 months of age, next is aged people who are 65 years and older, that is the elderly, people living with other chronic illnesses, people receiving chemotherapy. So we should all know people with less immunity power are most affected here, people living with suppressed immune systems due to HIV or other conditions. So these are the people at high risk. Now looking into the prevention, there has been vaccination for the influenza flu. First is through the injectable form. So they use the inactivated influenza vaccines. Inactivated influenza vaccines are killed vaccines who are unalive viruses who are injected into the bloodstream, and they act as a fake virus to fight for the immune system, so that our body gets resistant with the virus present. And next is the recombinant influenza vaccine. Here they don't use the killed virus, but they use the virus protein products, so it acts as a protein to the body and they bring in the immune system. And next is through the nasal spray, where they have the live attenuated influenza vaccine. So these are a bit weaker viruses who are injected into the body through the nasal spray, and they fight for the immune system. So these are the prevention methods through vaccinations. Now let us look into the measures taken here. First is monitoring and surveillance. The Integrated Disease Surveillance Program IDSP brings in the confluence of the state's effort, where they should keep a close eye on the cases of severe acute respiratory illness and influenza like illness. So here they both use A and B viruses, and influenza like illness is kind of a weak form of influenza, whereas severe acute respiratory illness is the most dangerous form of influenza flu, and it can lead to casualties, and it can also lead to hospitalizations. Next is virus research and diagnostic laboratories, that is a VRDLs, which is to be initiated by different states to analyze clinical samples for influenza and other through the local bodies. Now, looking into the strategies for vaccination, the Ministry of Health and Family Welfare need to have yearly influenza vaccination policies and programs, and next having regional specific immunization schedules according to the local districts. Next, looking into guidelines and public awareness, there needs to be materials for information, education and communication. So this is a strategy which is used mainly by the public health systems or by the social awareness programs, where they bring in information to the public and they gather materials to support their program, that is to inform the public. So next is having technical guidelines, where there needs to be extensive guidelines for covering the ventilatory care, having treatment procedures and patient classifications, so that there is addressing of different target groups. And looking for protocols for clinical management, there has been antiviral availability. The antiviral drug known as oseltamivir, or they are known as Tamiflu. So our Indian government, under the Drug and Cosmetic Act from February 2017, have brought in recommendation by the WHO, have brought in the sale of this antiviral drug, especially for the influenza, where there has been sale allowed under the schedule H1 of this act. So H1 is having prescribed sale of this particular drug. Next is healthcare infrastructure, bringing in N95 face masks and personal protective equipment, that is the PPE kits, have been in rotation for sale for the welfare of the and protection of the people. So we should all know that influenza like illness have also been associated with the COVID-19. So many of us were confused whether it was COVID-19 or it was an influenza, as the symptoms were somewhere equal. So integrating of the N95 face mask and also bringing in PPE kits were associated with spread of influenza as well as during the period of COVID. Now looking into the challenges, first is having low adult vaccination rates. So there has been overlooked due to the lack of information, misconceptions and the financial hurdles among the different target groups. Next is having limited government policy on adult immunization, bringing in healthcare access disparities and less surveillance gaps in the private healthcare. So we should understand how important the influenza flu in the spectrum of the public health system. So there needs to be even more policy implementation and strict following of those protocols. So looking a way ahead, first we need to develop a national flu vaccination strategy so everyone are getting benefited, expanding awareness campaigns, improving vaccine affordability and availability for different disparities, and strengthening the surveillance and data sharing. So including of AI and technology, Internet of Others can be a major change for the public health system. So I hope the article is clear. Now let us look into a mains practice question. The seasonal influenza remains a recurring public health challenge in India, particularly for the high risk groups. Discuss the measures taken by the government to control the flu and the challenges faced in its implementation. So I hope the discussion was a framework to this question. I also ask the students to put in their answer in the comment section. So thank you so much.